Hello and welcome to this edition of EC3 HOSA Medical Moments. We've been doing these tapings within the week to kind of bring our audience up to date on what is happening with our local area. And joining us have been Lincoln Trail District Health Department officials. Terry Bergen has been here in the past, and today we're joined by Melissa Phillips. Now, Melissa is pretty familiar to those in our HCEC TV audience because many times she has been featured in regards to addictive drugs, vaping, tobacco, things along that line. So I wanted to first start with Melissa. Tell us a little bit about yourself.
Well, my normal title before COVID was harm reduction specialist. And like you said, I've talked about drugs, I've talked about vaping, I've talked about tobacco in general, but life's a little different in public health with the COVID situation, and so now I'm part of the public information team.
And prior to our conversation, you mentioned that you all have two teams that work on weekends. Okay.
Correct. We have our Emergency Operations Center, and that group has now split into two teams, try to give us a little bit of a break so everybody's not working every weekend.
I was going to say, I know that you guys have been working brutal hours the last few weeks.
Yeah, schedules are a little different.
Yeah. So tell our audience, what are the latest things within this past week from the time Terry was here last Monday to today? I know a lot has changed in our districts, in our area, and what counties the Lincoln Trail District Health Department covers.
Okay, so just as a reminder, we're a 6-county district. We cover Hardin, LaRue, Marion, Meade, Nelson, and Washington. And like you said, the situation's very fluid. More tests come in every day. So currently, we have 54 cases in our area. 24 of those are in Hardin County, 2 in LaRue, 10 in Marion, 2 in Meade, 13 in Nelson, and 3 in Washington. And of those cases, we have experienced 1 fatality. But the good news is 46 of those cases are either at home or have been released from monitoring.
Oh, wow. So when they're released from monitoring, do they still need to self-quarantine?
That means they have completed their quarantine period.
Awesome. Now, with those that have already got through that, does the district work with the state or any of these medical labs in regards to pulling some of that good information from those individuals for possible, cures? I've been hearing a little bit about, maybe they may have some antibodies that they've built up that could help in the long run.
At the local level, what we're doing is we monitor the active case and any of their direct contacts. That means anybody that they were within 6 feet of for 20 minutes or more. So that limits our investigation because what we have found is most people are doing the right thing and they don't have that many contacts. So that's a good thing.
I was going to say that's really a good thing. So I'm assuming with those numbers that Hardin County is the largest in your district.
Right, it's the largest geographically.
Right. And last time Terry and I discussed the idea that we really don't need to worry about gender or age, that everybody should look to themselves as possibly being basically having COVID-19, that you should protect others by keeping that in mind.
That's exactly right. We should assume that everybody we encounter has the virus. So if we are practicing those healthy at-home measures, it doesn't matter if it's your next-door neighbor that's an active case, because you're doing everything you can to protect yourself and your family.
Do you think that there's a reason why some of the rural counties in the state has such low numbers?
I think that's a testing issue. Our larger cities like Louisville and Lexington have more medical facilities, they have more access to tests. We just don't have that here yet. Mm-hmm. And again, a positive test should not change your behavior. If you are, staying home when you're sick, you're only going out for necessities, you're limiting your exposure.
Well, and when you talk about the larger cities, Louisville, Lexington, and I'm assuming even up near the Cincinnati area, mm-hmm. those types of things, the problem is probably density, correct?
That too, people live closer together. They use services like public transportation that puts them closer together, whereas that's a benefit for us rurally. We're spaced out, geographically. So, that helps us.
What are some things that you all recommend in regards to keeping your sanity during quarantine or during lockdown or staying home?
You need to remember that home isolation is not social isolation. You've still got to find a way to creatively stay in touch with people. Yes, it's really hard mentally to be with those same few people in your household, day after day after day. So, if you've never explored FaceTime or Skype or Zoom, now's the time to do it. Because yes, it's not the same as a face-to-face, having coffee with a friend, but it still gives you that social interaction. And also, we've got to find ways to stay physical too. If you have a yard where you can do it, get outside on these nice days. And if you don't, find open public places like some of these large parking lots, where businesses are closed. Our walking trails are still open as long as people use their distancing. So get some physical activity too.
Now, your former role, or I'm sure you still handle it in regards to addictive needs and things. What about those individuals that do have that addictive behavior? Is there any help for them out there at the present time?
Mental health facilities are still operating. They just may be doing it a little bit differently. Mm-hmm. Your addiction centers are still operating, just maybe a little bit differently, but those services are still out there. So whether they're using telehealth or they're scheduling one-on-one meetings, those services are still out there.
Now, the role of the health department also is I don't want to say a business police, but you kind of do a good monitoring, a good thing in regards to that. Tell us a little bit about what the governor released last week in regards to businesses and what the businesses have been doing and what you do for follow-up.
So one thing people may not know is our environmental department is now called enforcement, because they are out there making sure everybody is doing what they're supposed to as far as the governor's mandates. So they literally are on the streets doing, check-ins to make sure our businesses are doing what they should. And honestly, our businesses are doing a really good job trying to enforce that distancing. Now, personally, I have observed that sometimes our citizens are not doing everything they can do, getting a little bit too close together, too many people per household out, and that's one of the governor's newest mandates is one person per household. You don't need to pack up the whole family when you go out to get those necessary services. So, that creates fewer people in the store, and that's the goal, because we got to keep people spaced out.
So you mentioned that a number of our businesses, they're really doing a good job. What are those things that they're doing? I know there's social distancing, but I've seen markings on the floor and just a little bit of everything.
Yeah, I've seen businesses pre-sanitizing carts, and they give you a cart when you come in, so it limits people touching the carts. They've marked, the 6 feet distance in their checkout lines. They've put up plexiglass barriers for their staff. So they have protection there. They've given PPE, that personal protective equipment, to their staff. So I really think that they're doing a good job overall.
Now, for those of us that are in the community working because our jobs are a necessity, what about us? What means should we be taking in order to keep ourselves and our staff members healthy?
A lot of businesses have started requiring temperatures at the start of the day. We're doing that ourselves with our own employees. So that's a good way to monitor illness. If you're not feeling well, call your supervisor and report that, and you don't need to come in that day. So the healthy at home measures. If you're not well, you don't need to be at work. You don't need to be out in public. Do you need to be wearing masks and gloves? It kind of depends on the work that you do. I've seen a lot of people using masks inappropriately. So we may touch on that in a minute.
Yeah, well, go ahead and say inappropriately.
The only time you really need to be using a mask is in, say, the grocery store, where it's difficult sometimes to do that 6-foot distance. Sometimes the aisles are too tight, so even despite their best efforts, you get just a little too close to other people. But I've seen people wearing masks in their own car by themselves, getting their physical activity. You don't need them then. This is just when physical distancing is hard. And masks don't take the place of physical distancing. The best practice is to use both in those situations where you have to be out in public. And again, when you have to be out in public, we have to be really careful, like you said, people go and stir crazy at home, that we don't turn the grocery store into a field trip. Okay? So that's kind of why the governor made the mandate of the one person per household when you do have to go seek those necessary services.
So when your environmental team comes upon a situation like that, what does that person do?
Usually it's just a verbal, hey, we witnessed this needs to change. And so they'll go back, and 9 times out of 10 the business has corrected it, and it's not an issue. But there are further steps, getting law enforcement involved if they have to. But we haven't had to do that. People really want to do the right thing.
Mm-hmm. I was going to say that with the weekend being a holiday weekend and everything, I know that churches were kind of first, and they really took forefront in regards to the governor's mandate. And it left people kind of on one side or the other in regards to that. But locally, do you see most of our area churches doing what they need to do?
As of this morning, I did not hear any reports from our district that we had an issue with a church service. Mm-hmm. We know some local leaders said, please don't do the drive-by services and things like that. But the governor really left it up to the locals to set that standard. But in our 6 counties, I haven't heard of any issues. Everybody really did find a way to worship following the rules.
Well, and I think that's one of the positive things that have come out, too, in that that particular church may never have reached out via social media and virtual services, but now it's kind of taken them beyond their comfort zone to do so, to meet that need. The protective devices, you said you don't really need to wear a mask in your car or gloves, but what about, so basically anytime you come across a stranger, when you're put in a position where you might be with someone that you don't know, those individuals, that's really when you need to think about the protective devices, correct?
Right. What you got to remember with the mask is if you sneeze or cough into that mask, that is protecting that person that's just a little too close to you, okay? That's why we said from the beginning the masks are for people who are sick. That's to protect the rest of us from their germs. Mm-hmm. But I think people have gotten a false sense of security with these masks, and they want to wear them everywhere. It gives them comfort. But, honestly, it's not necessary. And please only use the homemade masks. Do not use the surgical masks or the N95s that our healthcare workers need. Right now we're okay in our area with PPE, but, we haven't hit our spike yet. We haven't hit that peak, so we know there's going to be more cases, and we're going to need that PPE.
What do you think the spike or the climax is going to be? I've been hearing that a lot, that we haven't hit it yet. I guess what is defined by that? What will that look like?
The projections right now are kind of early May, but like I said, that's a projection. We have done a really good job in Kentucky of putting in measures early, so our climb in new numbers every day has been a lot slower than other states around us, and that's a good thing. But eventually, those numbers will start to get smaller and smaller every day. So that'll tell us we're getting close to that peak, but that doesn't mean that we can just take away all those protective measures, because what is going to happen is we're going to have another spike. So I know it's hard to be patient. I know this is hard to do the healthy at home, but for the health of as many people as we can, it's what we've got to do right now.
Mm-hmm. Now, your website and also the governor's website really provides terrific information. What is some of that information that people can access on your website?
We really try to put useful, everyday information. We have a tab just for the everyday citizen, and we have a tab for our healthcare providers. So that's a really good place to go, and our website is LTDHD.org. Just for general information, or if you're that healthcare provider, there's specific information and the forms you might need there. So anytime the governor makes a recommendation or issues an executive order, those are all there. So if you want to see that information, you can go to our website. There's a tab just for businesses. So there's a lot of specific information, and we've really tried to organize it in a way that it's user-friendly. So you don't have to, search the internet for that information you're searching for.
Now, one of the bigger discussions again has also been testing, and should more be tested? Should more individuals be tested? What is the health department telling individuals about that?
Well, we cannot say it enough. We do not personally test. So, if you call your local health department, we're not going to be able to test you. But again, the test really doesn't matter. A lot of times, by the time somebody's been tested, they've already passed that 14-day window. So if they had not done their healthy at home measures, they've been out contaminating people, infecting people. Mm-hmm. So don't worry so much about the test. If you are staying home, you're only going out for those necessary services, the test really doesn't matter, because we don't have a cure. We don't have a vaccine. That's coming, but we don't have it yet. So unless you are sick enough to seek emergency care, you're just going to be treating your symptoms at home anyway. So what did that gain you out there seeking that test?
Now, has this area seen any of the newer testing materials that have come out? Are you aware of that at all?
The more rapid tests?
Correct.
Not yet.
Okay.
I know that's coming, and I know we're going to get more phone calls after the Kroger announcement with the self-testing. None of that is coming to our area that I'm aware of, but this is a fluid situation. Things daily change. So a lot of times we learn with the governor's announcements. Mm-hmm. That's how quickly things change with this situation. So will there be more testing eventually? I'm sure there will be, but people really need to not get so concerned about being tested.
Well, and you work hand in hand, I'm assuming, also with a number of different agencies across the state in regards to what you mandate or try to enforce or try to encourage. Is that correct?
Everything comes down to us from the state level. So some things it's encouraged for local leaders to handle on their own, but a lot of it, you're right, does come down from the state.
So don't get upset with the health department.
Please.
If individuals, what about in regards to just not feeling well? That they have children that, may have a runny nose or ear infection, things like that. What's been in place for those parents or those individuals that might have that? Should they go to their pediatrician or their normal doctor, or what should they do?
You should always call first. Call your regular doctor first. Say, here's what we're experiencing. A lot of them are offering telehealth now because they don't want you in their waiting room. We really have to think of any way people are put in close proximity to each other. So please don't go to your urgent care, with a sniffle. please don't pack up all your kiddos and go to that pediatrician, because a lot of times we're in flu season, we're in allergy season. So they need to rule out all those other things before we even worry about, could this be COVID-19?
Mm-hmm. And they also said, I mean, Governor Beshear has also said that for prescriptions and things like that, doctors should be more available to issue those or renew those prescriptions.
Absolutely, and that was one of the executive orders that came out last week, is he renewed that executive order on prescriptions that gave doctors a little more flexibility on length of time.
Well, that really helps a great deal, especially with those that take that daily medication and, and when you get into pain management situations. We have discussed before, Terry and also the governor has discussed a lot about these closed facilities, such as jails or correction facilities, nursing homes. Are they doing a better job? How are we coping with that in our area?
The biggest concern in those types of populations now, and we're seeing it at the state level, is nursing homes, because that's a high-risk population anyway. A lot of them have underlying conditions. You know, they're in that over 65 age group, so they're fragile anyway. So definitely watching that population. We haven't had any instances in our jails that I'm aware of. So they're doing a really good job. They, early on put in place limiting visitors, then closing entirely to visitors, upping their sanitation. So our facilities locally are doing a really good job, but from the state level down, a population we're really concerned about is nursing homes.
Mm-hmm. And how do you work with the hospitals in the area that's in your district? Do you assist them in any way?
We get reports of positives from our local hospitals, and I don't know if it's been put out before, but HMH actually has their own hotline. So if you're experiencing symptoms and you want guidance, Hardin Memorial has their own hotline. It's 270-979-7777. So if you're in the Hardin Memorial Service area, you're having symptoms, you're not sure what to do, especially for those folks who don't have a primary care doctor, that's a good place to start.
Mm-hmm. And those individuals that may not have a primary care doctor, is the hospital the right place to start though?
If you don't have a primary care doctor, my suggestion would be to call the state hotline first.
Okay, and what's that number?
The state hotline is 1-800-722-5725.
And what type of information would they get, an actual person, or is it voicemail?
No, they should get an actual person. They get a high volume of calls, so if you have to call back, please do. We really need people to be patient during this time. Mm-hmm. Just like, the governor has brought on the unemployment head, they're seeing more calls than their system was built to handle. So that's kind of all of our different agencies. We want to help you. We don't want you to get lost in the shuffle, so please call back if you don't get to an actual person.
Mm-hmm. Now, another thing that the health department does is also the food service safety checks. Is that correct? Where, you go in and you issue that 95 rating or 99 rating. I'm assuming that's still in effect and it's up to the nth degree. So what's your role in that regard?
That's our environmental department. Mm-hmm. And yes, it's a little bit different now that businesses are only, carry out or curbside, but they still have to maintain those sanitation standards. So they're still part of their role. We just are calling them enforcement now to make sure everybody's doing the right thing.
I heard driving in this morning that there might even be concern about things that you pick up at the grocery store. Should you be, obviously, they cannot sanitize right after one person goes down an aisle, right, or another aisle. So that's just unrealistic. So is it going too far for individuals to kind of sanitize an item when they get them home or before they eat those items, I guess?
There's a lot we still don't know about how long the virus lives on surfaces. So if it makes you more comfortable to sanitize cans, or really it's going to be hard to sanitize cardboard and those types of containers. But if it makes you more comfortable to wipe those down, absolutely. The biggest thing I can tell you is when you get home, wash your hands. When you leave the grocery store, before you get in your car, use your hand sanitizer. And then when you get home, after you put your groceries away, wash your hands.
Now, I've noticed shelves are still bare of those sanitizing wipes, and you can find cleaner, but we still are having a little bit of a shortage or a supply issue in that regard. So is there something, if they don't have a hand sanitizer, really the bottom line is wash your hands?
Absolutely. Wash your hands frequently. Be careful about touching your face. If you cannot find the cleaning products you need, you can always make a bleach solution, the 1/3 cup of bleach per gallon of water. So there are ways to sanitize. We don't recommend vinegar. It doesn't kill the virus. But bleach, definitely.
Okay. Is there anything that you wanted to share before we wrap up today's show? That information that you needed to make sure that you got out to the public?
Just remind you of our website, the LTDHD.org. A lot of good information there. We monitor it daily to make sure things are accurate and are user-friendly. And just, remember those healthy at-home guidelines. I know it's hard, but it's for everybody's good.
Okay. Well, and I know that we're in this for a while.
Yes,
You're going to be in this situation for a long period of time. So patience is something everyone needs.
Absolutely.
Well, thank you, Melissa, for joining us today. And we'll have to come back again maybe next Monday and talk over some of the new things. Because like you said, by the time you will see this at home, this information has already changed. So go to the Lincoln Trail Health Department District, and that is LTDHD. LTDHD.org. Okay. And thank you for joining us for this edition of EC3 HOSA Medical Moments.